Um, so as you know, it is a very political issue, not just in Europe, it's everywhere now, and especially irregular migrants when they cross the border. And we have this a lot of wave of irregular migrants in Europe, but it's also in the US and other countries like Turkey and so on. So when we look at this survey related to the concern about irregular immigrants or immigrations in general, all of the country, this is for Europe in 2022, all the country, they say, yes, we are a lot of concern. So there are any country really that at the moment are not concerned with migrants. And there is this survey that was run by King's College in UK in 2022 also, and they ask so many countries what they thinking about migrants, and they say, of course, many of them say we'll probably need to place strict limits of the number of foreign who come here. And many thinking about, especially United Kingdom and Germany and also Canada, what they thinking is let's people come in if there are jobs available, but otherwise we need to restrict a lot. So of course we have this policy like Brexit and many other things going on now in the moment, in many countries related to migration. But so there is a huge concern there. Of course, the main fear that usually the populations, the native found is the fact that migrants come in. There is usually two or three. One is the job security, the terrorism, and the criminality, and also a little bit about the health effects in the sense of the use of welfare and public service. So the effects of immigration on the labor market is huge literature now, and there is this usually migrants that are two types for economic reason and refugees. And they are a little bit different when the effects look at the effects on the job market, of course, because refugees they are more strict in terms of what the type of job that they can do and so on. Instead, immigrants for economic reason usually are more freedom to come. And you are also many of immigrants, especially in Europe, are low-skilled immigrants than very high-skilled immigrants. And so many of them tend to enter in this job that are construction workers, cleaners, driver, factory workers. And there you have the evidence. It's a little bit mixed. There are some papers that find that usually migrants has no effects on the labor market, and so but they increase the wage of the natives and also decrease the unemployment rate. And there are some other papers, especially Borjas and others, that found that usually there is some competitions with the low-skilled immigrants, so they can increase unemployment, reduce wage, especially for this type of natives workers. On public service, also there is this fear that migrants come in and so they can use a lot of the welfare, housing, school, healthcare. And so on this public service, and evidence is not too much here because it's very difficult to find information about how much welfare, how much the effects on housing and so on. And there we see that this paper on Dustman and Frattini for UK, for example, they found that there is no effects on healthcare, on welfare and school, a little bit on housing price. And our paper will look at the NHS waiting time. We find that migrants, where you have more migrants in an area, usually the waiting time tends to go down. So there is no effects really. We know very little about the fact that maybe migrants also have an effect on the labor market, through the labor market, on working condition, and so on occupational risk and injury. And we know much less there about how this is maybe affect the migration can affect like working condition, occupational risk, and injury. And these are matters because, of course, will affect the individual welfare, productivity, and public health expenditure. So, on the conceptual framework here, usually immigrants are concentrated in this manual, physical, demanding task. And usually this is allowed to natives to maybe retraining and go in more managerial task, or this is a service task. So there is a kind of a shift from natives in the type of occupations. And usually what we find also that immigrants are health selected. So usually the people that tend to migrate are healthy, and when they arrive in the country, they are healthier than native. And so we also found there are some people that they found that there is more also this tendency to low risk aversion. So they tend to have less, they take more risk than native. So if we look at these general equilibrium effects here, we can see that immigration can just reshape the job compositions, and so could affect the work condition and health outcomes. So immigrants so go in this more physical demanding and hazard tasks. This is reduced native exposure to workplace risk. And so native work shift to less physical intense and more safer occupations. And usually this especially on medium skilled worker. And so could be associated with low physical burden and few injury, and so improve the health outcome of natives. And this is what we found in our paper. So the first paper I will present today is the immigration and health outcome. This is a study for all Europe, and we look for 15 countries in Europe, and we look at the study on native health perceptions and health limitations. And so we know that immigration has so increased a lot in Europe, especially after 2000. So there is this concern that immigration may worsen native living condition because they cannot access the healthcare, or there is this crowding effects in the hospital. So the research question that we ask here, does immigration affect native self-perceived health and health-related limitation? And so we use the survey. The EU Silk survey is a individual survey for all of the European countries from 2006 2018. And there are many questions. One of the two questions that we take in account here is the self-perceived health and the limitation in daily activity. And we have done this at the regional level in each European country. So we have 16 European countries here, and we have also linked this data with the labor force survey data that are data that look at the workforce and where we can find immigrant and the share of immigrants in that region. And so our outcome here are percentage of reporting bad or very bad health, and the percentage reporting health-related activity limitation. What we found, of course, this is just the descriptive here. So we know that the share of immigrants across country in Europe from 2006 2018, we take the average here is a change. Of course, there are countries with a lot of immigration and a country with low immigration share. The share of immigrants has increased a lot across time. The bad health is quite stable across time in Europe. And if you really look at the limitation in daily activity, we can see that this has grown. Many of these probably come also from the fact that population became older in Europe. And so if we look at the health outcomes, we can have bad health outcome across country. We can see that country with, especially Southern European country that those have less migrant than the northern country have also bad health. And instead, the limitation activity, it is a huge variation also across that. So the model that we use here is a country year panel fixed effect model. We control for many characteristics like demographic, labor market, and macro condition. One thing that we need to take in account when we're talking about migration, migration is a factor that usually, as is not random allocated across the country, but usually they tend to sort in certain area because there is network there, okay? And so also maybe this is also maybe that healthier people tend to go in certain area because just they have more network. So this is create some kind of endogeneity or reverse causality that could bias your results if you not take in account. And so for that, we use an instrumental variable. And this is based on historical settlement of migration in that areas by origin. And we follow the approach in literature immigration that it's a method that has used it a lot in the past for taking account the sorting that you can find when you're talking about migration. So what are the main results here? So when we look at the self-perceived health, there is no evidence that immigration worsen the native health. So there is some a small negative, that means beneficial effects, but it's not statistical significant. When we look at the health-related limitation, immigration significantly reduce activity limitation. So means that more immigrants you have, you are less limited, and so there is more positive effects for immigrants on health of native health. And this is about 5% of decline in the limitation. So we can see that there is these correlations here between bad health and the share of immigrants. So when you have low immigrants, share of immigrants, you have also high bad health and vice versa. And the same for the limitation. So we don't find any effects here for bad health in migrants' results. Instead, when we look at the immigrants' results, and the limitation activity, we can see that the limitation will reduce when so increase the number of migrants in the area. So about the heterogeneity interpretation, who benefit most, we find that usually these are the old people in the country with lower human capital, and they usually are women. Why? So the interpretation is coming here. Immigration usually like to reallocate, especially care work that usually is done by women. And usually these women, so maybe now they can hiring immigrants to do care work, and they can do other type of activity or reduce their activity. And so could create less stress, health stress on women. So, and this is particularly beneficial in low skill economy. So when we take in account the human capital index, this is an index calculated by Eurostat, we can see that seems that the country, and usually our Southern European countries, seems that are most benefited by immigrants in, especially in bad health and the limitation in activity. So if there is no question on this one, I can move to the next one. It's up to you if you prefer to ask questions now or later. I can move to the next one.
Let's maybe ask questions at the end.
Okay. So then all the papers we also continue in this area is the effect of immigration on occupational injuries. So for the same reason of before. So if immigrants come in and they take a certain type of jobs, so there is some kind of reallocation in the type of occupations. So we should expect some effects also on occupational injury. And we use this administrative data in Italy so that we have all of the informations there. So usually we can find that immigrants tend to work in these 3D jobs, dirty, dangerous, and demanding. And the injury rate gap usually between migrants and native is persistent and still there. Usually migrants have a high injury rate than native. Does immigration here worse to improve native work occupational health? So, especially affecting injury rate, injury severity among native workers. So, when we look at the injury rate of native, and this is the blue are native and the red are immigrants, we can across time usually they tend to go down, but also immigrants usually tend to have a high injury rate than natives. If we look at the data, so this is are all injury reported by individual from 2009 to 2017. And this is all the type of injury in the sector, the company they have, and the number of sick leave days, the degree of impairment, and a lot of informations we have there. And so we have linked also this data with the share of immigrants in that area in the province of each province in Italy. We have 21 province. And so we later on have also looked at the Italian labor force survey to understand the mechanism that can explain why we find this information. So we have a sample of 91 provinces for 10 years and for workers aged between 60 and 65. And we have here the whole universe of work-related accident. So if we will look at the descriptive between migrants and native, we can see that usually migrants have less degree of impairment, less number of sick leave day, and usually they have also permanent injuries less. Of course, they are more male, younger, and with a lower education, especially secondary educations, and most of them is working secondary third sector with respect of migrants. And also we can see that many of them are between the age 26 and 49 instead of natives tend to also have higher old natives in the group of 50, 65. So again, here we use our baseline models regression where our outcome is the injury rate and the injury severity. And for severity, we'll take out the day of sick leave and the degree of impairment. And what we look at our foreign-born share, we control for province and year fixed effects to take in account any change that can come in that province and also the GDP in that province. Again, we have a problem with our endogeneity reverse causality because the share of immigrants in that areas could be sorted by the fact that there is some network and so more. For example, Moroccan people tend to go in that province because there is a strong network in that province, so it's not random allocated. So what are the main results here? The main results tell us that for when we look at the injury rate, immigration reduced native injury rate about 8 to 11% reduction relative to mean. Injury severity, we have 3.5 day reduction. So if you increase the number of immigrants in that province, we obtain a reduction in native injury rates and also in the day sick leave. And who are the ones that are more affected by this? Usually are older native workers in the construction industry and manufacturing sectors. We can see here the effect on occupational injury rates for sick leave, degree impairments, and by sector and age. We can see what I already say. So what are the mechanism and the interpretation here? Again, there is this task reallocation. So we use the labor force survey, and we can look at the occupational physical intensity. This is so for each occupations, we can attach a degree of physical intensity of that occupation. And so we can see that migrants sort in this riskier task, and this is 30% higher than natives. This means that immigrants reduce native exposure to physical demanding tasks and hazard activity. When we look at the job reallocation here, we have not found any effect that immigrants push natives to more unemployment or push native, for example, out of the province, because one say, okay, but this is because maybe native have decided to leave the province. So for this reason, when immigrants come in, you can find less accident there, but we don't find any effects on that. And the same, you can say, okay, maybe natives tend to go unemployment. So if they don't work, they reduce the activity and the probability to get an injury. But again, we don't find any effects on that. So it doesn't seem so that migrants have any effects on unemployment and out of migration region. So what we found here that usually immigration improve native occupational health and also without occupational sector mobility. So we don't find usually change in sector, but what we can find here that they tend probably to reallocate the type of task that they do in the same company, in the same sector. And so could explain our results. So when we look at the exposure, we can find that if foreign born tend to be higher in the physical intense task, especially this work that usually require this 3D job that usually require more physical intense. So what are the conclusion here? So immigration usually tend not towards native health outcome, but seems that they tend to reshape the risk and the physical demanding task, and this reshape can reduce the injury, the physical burden, and the health limitations about the populations, and so usually who benefits most of these are older workers in the medical natives, especially in the country like a Southern European country. And this is come more through a general equilibrium mechanism than just like more unemployment or health system congestions that could explain our results. So this is not the fact that migrants push natives in a different area or push natives like out of the market. So what also we observe here that usually migrants tend to have a more higher injury rates than natives. And so we need probably also maybe for policy implication to take in account more occupational safety and integration policy for migrants, because could be one of the issue that it's true that they have take more risk. They tend to go in this type of kind of work. Means also more injury for them, although they are healthier and they tend to have less injury for the same type of task or sector. But could create some burden in any case for the governments. So this is the policy implications that we can see here. And I stop here in my 30 minutes more or less of presentation.
Okay. Thank you very much. Very interesting. Can I ask a couple of
Yeah,
questions
sure.
before we open it up to other people. Um, you present a very favorable argument that
Yeah.
immigration is a positive thing. So why is it, I mean, that there's such a sort of recently, perhaps, in the UK and the USA, right? Such a backlash and other countries in Europe against immigrants if there's now, objective evidence here that it's a good thing for natives when immigrants come into the
Yeah.
country.
There are, of course, I think this is more a political issue, and immigrants, such as other things, became political tools that it's quite easy. It's a card that quite easy to play because, of course, everyone has fear about people that are foreigners that come in, and so you can say, oh no, we don't want them. Of course, there is. Especially, I think for low skill people, there could be some competitions there in terms of jobs. But we know, for example, in UK that there are jobs that usually natives they don't do, and we are a shortage of people there. Now we don't want to recognize that, and also I think any politician is interested more in these kind of things because no one's want to buy this really. It is easy to buy the fact that immigrants come here. For example, I remember Brexit, our paper on NHS and waiting time was just before Brexit. And we can show this evidence that usually, because one of the big topic was immigrants take the NHS and the waiting time goes up because there are a lot of immigrants. And we show that where you have a lot of immigrants, usually NHS waiting time goes down, not up. But of course, they don't want to to buy this. Yeah.
Now, why? I mean, politics aside, why did you find that? Why was it that wait times actually went down, or at least were
Well,
lower
because
where
usually
immigration?
yeah, immigrants are healthy and they don't use hospital. I never been in
Uh,
the hospital in UK, never,
right.
and 20 years. And so usually there is this selection of migrants. So the people that decide to need to migrate usually are in good health, better than native when they arrive. And so there is this health effects migrants. And so when you arrive, usually you are young and you are quite healthy, and so you don't use the hospital. There could be some crowding out effects for housing, school, because you cannot construct housing very quickly. You cannot construct more school very quickly. So there could be, especially in these areas where I can see maybe a little bit more effects on maybe housing price and the school, but on health, probably not those on the labor market.
Got it. Now, my other question was, I think you said that the immigrants tend to have higher injury rates, right?
Yeah.
Right now, is that sort of controlled for the same job that
Mhm.
a native born worker would do, or is it just because in general they gravitate towards those 3D jobs that maybe natives don't want to take because they're dirty, dangerous,
Yeah, it is more
and
because they
risky?
gravitated more in this type of job, really. And so these jobs are usually high injury rates. And so for this reason, they tend to have high injury rate respect to native. But when we compare immigrants and native in the same place, in the same type of occupation,
Uh,
usually migrants have less injury than natives. And we try to explain this like by the fact that imagine you have two constructed workers. One is native, one is migrant. Usually the migrants one that work in construction with the same type of occupation is younger than the native. And this could explain why when you look at the same type of occupations, we can find that native have higher injury rate than migrants because just because this is health effects in terms of age, really. or
Maybe I'm sorry. Maybe they just report less injuries because of social security reasons.
yeah, well, if they can, for sure, illegal immigrants are not here. You're right, because if you are illegal, you cannot declare this injury, because otherwise, the company will enter in the penalty and go in and a very uh, trouble. And so, in these cases, illegal immigrants probably tend to report less injury, and maybe they tend also report less injury because they don't want to lose their job. But this should not explain why the gap is higher. So maybe we underestimated the number of injury rate of illegal immigrants here. So because maybe the injury rates of migrants should be higher, and so we didn't take in account that. But yeah, but this is going the direction that maybe we underestimate the number of injuries.
I wonder, can I ask?
Yeah,
Of
sure.
course.
Okay. Thank you for God. Thank you for a great talk. I'm sorry that I was a little bit late. I was in a different meeting that took a little bit more time. But I wonder, I didn't see that you refer to Israel. And I think that Israel, for example, is a specific place. Did I miss it?
No, you didn't, because we actually started late. So be
Okay.
interesting to hear what you think Israel versus Europe, the UK,
No,
etc.
because I think first of all, immigrants in Israel, it's a completely different set than immigrants from other countries or other countries. We have immigrants that are coming from different reasons, not just to mainly not to improve. I'm talking about aliyah. It's not to improve the working status or something like that. It's a different setting. So I think maybe it's an interesting place to do studies. And I think there are a lot of studies that in this setting, when immigrants is just about immigration, because when Jewish are coming to Israel, they have a lot of benefits that they receive to
Mm.
be part of the country. They receive, they have a specific time that they can learn the language, and they have a specific amount of money that they can buy buy car, and the country helping them to be part of the society. So I think maybe it will be very interesting to compare different type of immigrants, because it's not immigrant to as a worker immigrants, but
Yeah, no, I agree.
migration
Ideological. Yeah.
and changing places can affect your health. So I think it's important question, and maybe it's an interesting case study for you to
No, yeah, I
compare.
agree. Yeah. No, it is true. For example, we have also looked at sometime at the refugees, and that usually are not selected, because usually all the refugees come in and usually there is no selection. It's just more random than migrants that decide to go in that country. And we can find a little bit different in terms of effects on the use of a healthcare system. So there is a little bit more use, because when the refugees comes, usually are old people too, not just the youngest one. And so could
Exactly.
be a little bit more this kind going on. But it is true that the reason could be different, and of course, the also the health of natives in terms of mental health. It is something that are less considered, because it's very difficult to find these informations about mental health for migrants. Of course, there is some evidence that usually mental health is a big issue for migrants when they go to another country, but it is difficult to
And also the
pick up.
food. And
Yeah, the
also
food.
related to the food, because, for example, in Israel, the Ethiopian population suffering much more with the diabetes. And I
Yeah.
know that this type of things also, like diabetes in the Japanese population in the United States, compared to the Japanese population in Japan, it's also very different. So I wonder if you did anything related to food and
There
differences,
is a one
diabetes.
study that my co-author has done on the US population and foods, and they can see that usually the first wave of migrants is usually better health than native, but after they catch the natives' health in terms of foods, because especially the second and third generations, they really adapt to the country very quickly. They have done this for Mexican migrants in US, and they see that the first wave of migrants usually they eat better, their food is better, and also they come with their traditions and so on. But the second, the third generation, they catch up the natives in terms of this kind of junk food and all these kind of things. And so, of course, the also there in UK is more or less the same. We have first, second, or third generation. In the other countries, especially Southern European countries, we still have only one generation of migrants because the second one is now very young. But of course, also these factors are important to consider there, especially how you adapt to the country, really.
I'm just gonna. Thanks very much, Ken. Great question. I'm just gonna read Tomer's question from the chat. Thank you very much for the lecture. Fascinating. I wonder whether there were intra-country changes. For instance, the same country by different years of health outcomes. Correct me if I'm wrong, just quoting. But I understand you evaluated changes upon proportion of immigrants of the whole continent population, the whole country population. So, any studies on migration within a country, or maybe from outside the country into the country and then within the country?
So all of the migration here is migrants that they born outside the country. We take this definition, so it's for needed to foreign born to
Right.
be migrants. Otherwise, if it's second or third generation, it will be difficult if you are born in the country. So in this case, we consider just migrant. Of course, in the European country, we can consider migrant. For example, you take Germany. If we take Germany, also, if a Spanish person go to Germany, we consider that immigrant. We have a disentangle a little bit if the migrants come from Europe or come outside Europe, we can do that. So if we are European, Asian, or other type of migrants in the same, for example, the other papers we take because we know that the country where you migrate, it could be different effects on terms of that, because we know, for example, European that tend to migrate another European country usually are high skill, put in that way. And so they tend to go in certain type of jobs instead, for example, migrants that come from North Africa, they tend to go with certain type of job. And we take in account this distinguish where they come from. Of course, there is some also change of internally. We can see, for example, in one paper, we have seen that migrants tend to push natives outside certain area. This is true for UK. We didn't find this for Italy, for example, but for UK, we see that when migrants come in area, usually natives tend to leave that area, tends to find another area, and so there is some reallocation, but not especially in the South European country, this doesn't happen too much.
Okay. Can I ask a question? If you know, let's say take Germany, right? The reunification of Germany in sorry about the buzzer, in 1990 or so? Did that have an effect in terms of health patterns and healthcare outcomes?
There are
When,
some papers that look at that, and when especially the East Germany went to the West Germany, and so there is some effects there. And they look at the effects on health, and they cannot find too much effects on health outcomes. They found some effects on the job and the job market, but not on health really. In our case, we take in consideration here the region fix effects that what they try to do is everything that happen in a region, imaging, for example, a new company go in that region or that region became very poor or something like that. So we take in account that because this is across time, so we can consider this time variation and so take in account the difference change across time. But yeah.
Thank you. Any other comments, Leah?
Yes, I liked about your research and the sophisticated analysis that you have done. And it reminds me research that I read once about social mobility. That social mobility is higher in places, in neighborhoods with many immigrants.
Yeah.
Among natives, I mean.
Yeah, do you mean the social mobility in finding the job for second and third generation? Yeah. Well, it is true, and there is a nice paper by Dustman and people where they can see that the second and the third generations, they still have some wage gaps and educational gaps for respect to natives. And you can see that they still there, so you then don't catch up much with the natives.
I'm sorry, I meant something else. That in neighborhoods with many immigrants, social mobility among natives is higher than in places with the same sex, but with less immigrants.
Yeah. Okay. I don't know why this could be the cases. Maybe because I don't know. It could be explanation maybe related to the type of job that they do or why. Maybe there is also some sorting here because native that decide to stay in neighborhood with high immigrants usually tend to be different than natives that move more in these areas that with less immigrants, and so could be some factor that can explain that, right?
Yes, maybe.
Yeah, there is some sorting that could come there.
Right. Well, I mean, we've touched. I'm sorry. I was going to say we've touched upon the difference between, let's say, immigration into Israel, which is very much encouraged and often is for ideological and religious reasons, and the difference between immigration, let's say, in Europe. I mean, does anybody know if studies have been done in terms of the effects of immigration of Ethiopians, of Russians many years ago? I don't know, immigrants from France, the United Kingdom, the United States, and on sociological factors and health related factors in Israel?
Well,
In
first of all,
Israel,
the immigration from Russia saved the Israeli health system.
Yep,
because
100%. Yep. All those
because
doctors.
so many doctors arrived. So, and now we are dealing with the fact that many of them
They're
are
retiring.
retiring. Exactly.
Yep.
So I think this is an interesting case study, and it's very different. It's not immigrants that in the 90s, that's not immigrants like in other countries.
Yeah, no, it's fascinating, really. I just saw only one in economics is done from the Russia migrants in Second World War to US and the effect on the job markets, not the effects on the health, but on job market. And they can find that as again, all of these migrants were very highly educated, so they can start to look at this as innovations and have a huge effects on innovations. So I don't know, Israel, it's quite fascinating on fact that you have a lot of migrants from different parts of the world coming. I don't know also if you have the data you can do that and you can
It-
see the effect.
Interestingly, that because we are a country of immigrants, so every data set almost always include country of birth.
Yeah.
And so many times you can see that where my parents arrived from, and where I arrived from. And there are many studies about education of first generation, second generation, health status, and so on. So it's something that we always include it because it's kind of
Yeah, sure. Taken in
it's like
account.
ethnicity also. It has another layers of confounders that we always adjust
Yeah.
for.
Yeah, no, for
Now,
sure.
now in Israel, we have many doctors who came from Russia in the last 4 years because of the war with Ukraine. And in some places, some departments are almost filled with people who came in the recent years. For example, heart surgery department in Shiba.
Really?
Yes, there are several heart surgery departments. One of them, the one with Professor Steinik, they have Russian doctors, and another one, the endoscopic department, that is, they have native-born Israeli doctors. And Anastasia is also almost owned by Russians.
Yeah, I was going to say that. I mean, I've gone to Ziv, up in Svat a lot, and every single anesthesiologist in at Ziv Medical Center is called Alex, called Sasha, right? Because they're all
Yes.
Russian.
Mhm.
It's
Very
interesting
confusing.
fact, really.
Okay, and also I'm interested in this subject about immigration and refugees, maybe because I'm immigrant, and it occurred that after the Ukrainian war between Russia and Ukraine, I spent some time in Japan with Ukrainian refugees. And I saw how they get accustomed to the place and what help they get from the government. And after that, I spent some time with refugees also from Ukraine in Poland. And they were in very different situation. It's a long story to tell. If you're interested, I can tell you, but it's really a long story. I just want to say that it's very, very different. And
Yeah,
the
no,
people
that
who came to Japan and people who came to Poland are also very different.
no, I can imagine the access of the healthcare system is different and what they give to
Yes.
refugees. For example, in UK, Ukrainian refugees, they have straight access to health and everything. Instead, the older refugees,
Mhm.
it is more complicated for them to take out. And the same has done in Italy. I remember the refugees from Ukraine, they give access straight away to all of them with the card. Instead, the regular immigrants that come in, they don't have any kind of cards, so we'll look at the access also is different. So it is something important to consider. We know that the refugee population is quite a bit different than migrants, that also irregular migrants, because irregular migrants are stronger because and more less risk averse, because you need to take a boat, you need to go through the sea and so on. It's very risk. You take a lot of risk there. And second one, it is quite strong. It's very difficult that a person that it's not in health, for example, to arrive in Italy or in Spain or in UK.
Mhm. Yes.
All right. Any final questions? Very interesting. Well, thank you, everybody. Thanks for attending and being very participatory as an audience member.
Thank you,
And
Elliot,
obviously,
for
thanks to
organizing
Katia.
this.
This was it's a
And thank you,
pleasure.
Katya.
And Katia,
Thank
this
you
was
very
really,
much
really
for
good.
all of the questions and all your comments, and thanks, Elliot, for organizing this.
No, it was.
Really
I
good.
find it fascinating. I mean, immigration is so important to Israel that it's
Yeah,
something
no,
worthy
it
of
seems a
discussion.
quite interesting area, and yeah, to take a look, really. It's quite interesting. Thank you very much.
Thank you, everybody.
Bye.
Thank you.
Thanks.
Take
Have a
care.
great
Bye
rest of the
bye.
day.
Bye bye. Bye
Bye bye.
bye.
Thanks, Katia. Bye bye.
Bye.